And how would sex therapy differ from traditional talk therapy?
So probably the aspect of sex, just literally
Right,
bringing up sex. It's usually something that we don't talk a lot about, especially in a professional setting. And so being able to just open up that conversation.
Welcome to Posture and Purpose, where both healing and community come together. Make sure to subscribe on Apple, Spotify, and YouTube. Let's get into this episode with Dr. Michelle Carr-Frank.
Hello and welcome to Posture and Purpose, where health, healing, and community come together. Today I have Miss Gabby Lopez, a sex-positive therapist who practices here in Lafayette, Louisiana. So welcome, Miss Lopez. Thank you for being here.
Hi, thank you so much for having me.
So tell me a little bit about what a sex-positive therapist is.
Great question. A sex-positive therapist is a therapist that really empowers people to understand what they enjoy, who they are. Really somebody that is not shying away from certain things. Our society makes sex a very taboo topic. So being able to offer a space for clients to be able to talk openly about sex and about what they enjoy.
Okay, so hopefully that clears that up for everyone, because I'm also learning as we go. And would you mind sharing with us what path brought you and led you to being a therapist, and especially a sex-positive therapist?
Sure. So being a therapist, actually, I guess it was a kind of natural journey. I've always enjoyed talking with people and getting to know them. I think the sex part of it came a little bit later whenever I was talking about those types of topics with friends, and they were the ones that were kind of mentioning, wow, you're somebody that's really easy to talk to about these things. And that got me thinking that maybe there's an area for this. And so being able to offer a spot for people to talk about their sexuality, especially in the South, and in a place where we don't talk a lot about it. And
especially the South, females, big Catholic community.
Right. A lot of stigma, a lot of shame around sex. So being able to kind of destigmatize it, take away that shame, and let people kind of explore and get comfortable with themselves.
Yes. And where did you receive your training?
So I actually went to school at UL, University of Louisiana at Lafayette, for undergrad and graduate school. I got my master's in clinical mental health there.
Wonderful. Well, UL has graduated many wonderful people, as we know, and you must be one of them, because I'm so glad that we have you here in Lafayette and that you're able to bring this topic to the forefront. Mm-hmm. You know, I think it's very important. And how would sex therapy differ from traditional talk therapy?
So probably the aspect of sex, just literally bringing up sex. It's usually something that we don't talk a lot about, especially in a professional setting. And so being able to just open up that conversation in addition to how your relationship is and how do y'all get along emotionally and how are y'all, having a great time together? How is your sex life together? And just making it a topic of conversation, just as kind of you maybe ask about how is your back doing, being able to ask how's your sex life doing and have that be a casual type of conversation.
That is so interesting to me. What do you find that people most misunderstand about your profession?
Probably that sex positive means I'm saying have a lot of sex, and that's absolutely not the case.
Okay, we cleared it up.
Yeah, it is to have the sex that you want to have, and being able to get couples talking about these types of conversations together so that they can understand themselves and their partner, so that they can have a satisfying sex life.
Interesting. And what is the most common lie that people tell themselves about their sex life?
Oh, that's a good question. A lie. Probably the worry of like, this isn't normal. I think so many people get nervous about what they enjoy and they're kind of tiptoeing around it. And so allowing them to kind of put that down of, there's no normal. It's all about what do you like, what don't you like, and being able to express that.
Yeah, it's an individual thing for sure.
Mm-hmm.
What questions are clients secretly hoping you'll ask them, but you rarely do?
Ooh. Question that they're secretly hoping I ask, but I rarely do.
Only because with that topic, they might not want to bring something up, and they're hoping you'll ask.
Yeah.
So they don't have to bring it up, but they want you to ask to lay it out on the table.
I think people are probably most concerned with like the frequency. Like they're wanting me to ask, how often are y'all doing it? And that's usually not the question. It's usually exploring how are they enjoying what they're doing? Is it often enough for them? Not that there's a specific right or wrong amount of times to be having sex with your partner.
Again, an individual thing among couples.
Uh-huh.
And what are the most common intimacy challenges that couples bring to your practice? I'm sure it varies with age groups.
Population,
male, female. I mean, there's so many avenues that we could explore.
Yeah.
But what do you find is the most common?
As you're saying that, the first thing that pops into my head is the orgasm gap. And so what that is that men typically orgasm more than females do. So it creates a gap in our experiences. So heterosexual relationships, there's a lot of maybe resentment towards why are they getting to achieve their pleasure, but I didn't get to have my experience. And so kind of being able to touch on those different needs, different desires. I know a lot of something else that comes to mind is the difference between spontaneous desire and responsive desire. So,
okay, tell us about that.
Yes, spontaneous desire is what we typically think of whenever we think of somebody wanting sex, and it's just instantly when we think about it and we're in the mood, like we're in the right moment to do it, we should probably want, like that's what spontaneous desire is. Versus responsive desire is somebody's body needs to respond to emotional connection, maybe kissing, touching, cuddling, and then they're wanting to move forward with sex. And so being able to understand that not all of us instantly want to have sex, and that doesn't mean that something's wrong with our partner. It means that we need to understand our own desires, our own arousals, those things.
So interesting. Well, thank you for clearing that up. How closely connected, it's perfect with that answer, brings me to my next question. How closely connected are physical health, nervous system regulation, and sexual wellness? And I think a lot of that, like the spontaneity of sex, like physical health, but also nervous system regulation along with that. And how does that overall change sexual wellness?
I would say that they're all interconnected together. And so if you are having some nervous system issues and you're constantly stressed, that's going to impact your wanting to have sex. And if you are in pain, if you are physically, exhausted, you're maybe not going to want to have sex, and that's normal. And so being able to take care of yourself first and foremost, and then being able to have that pour out onto your sexuality and you being able to enjoy your sex life, because it's normal for you to be exhausted and to not want to go have sex. And I think people pressure themselves in that way of, I should be wanting to do this, even though there's so many factors in their life that it makes sense that they're not wanting this right now. And they need to be able to relax and to push these things aside to be able to kind of focus in on their sex life. Yeah,
makes sense. I know in my field of chiropractic, you wouldn't believe how many people either hurt their back during sex, or if they're having pain, they come to me and just in tears. I can't have sex with my husband because my back hurts so much, or my neck hurts so much. And I mean, physical health,
Right.
physical wellness. It
Right.
really does have an emotional toll sometimes. It takes that toll on people, because I've seen that part of it in my practice.
Yeah.
So, with that said, what about the role of stress? We all have stress in our lives.
Oh, yeah.
What role does stress play in intimacy and desire? And I know you kind of touched on that with if you're exhausted. Sometimes you're just not going to want to feel like having sex. But how does that affect a relationship?
I think it has the potential to definitely affect the relationship, especially if we're not educated on these things of stress impacts your sex life, and that if you are in a stressful environment, if you are under constant stress, it makes sense that your body is not in a place of rest, relaxation, ready for pleasure.
Right.
And so giving, I guess, people the permission and the space to deal with that stress, to understand that their body is worth having that moment to relax and to help them to be able to kind of prioritize their nervous system relaxation, so that they can get to a place of what do I enjoy, and being able to get to a place of excitement and play in that way.
Right. Not like, okay, 6 o'clock, I'm going to finish the dishes. We're going to have sex at 7.
Right. That's not working. And that's fair. But I think people expect it to work that way. And that's the problem, is that our body is not a machine. We can't just, okay, now we have to actually
very naturally
unwind and be able to get into that playful mindset.
Yeah. That zone.
Yeah.
So with also playing a part with physical health, why is sexual health an important part of overall well-being and not a separate issue or a separate topic? How does it all come together as one?
That's a good question. Sex is, it releases endorphins, and it actually, there's so many studies that shows how positive of an effect orgasms and sex has in our lives. And so being able to incorporate that with our wellness routine and seeing it as a part of our wellness routine, I think could shift how we see it as a whole part of wellness.
Do you know about the study that was done, maybe it was in the 50s, about the man who invented the vibrator?
Yes.
Okay, so when you said that, and look, I'm trying to whisper.
I see it already. You're like, ooh.
I can't help it. Catholic schoolgirl here.
It's normal. Yeah.
You see, but once that invention happened, they realized those endorphins and these women that were so stressed out, that it actually changed not only their sexual health, but their overall health and well-being.
Yeah.
So you're familiar with that?
Yes, absolutely. And I wish more people were familiar with that.
Well, it made, when I read about it, it made sense to me, because of course I'm all science. But it made sense to me because, being raised Catholic and being raised in a community where you do not say the word sex.
Right.
You just don't talk about that.
Yeah.
And sometimes things like that need to be brought to the forefront.
100%. Yeah.
So I thought that was an interesting topic since you brought that up.
Yeah.
And why do so many people confuse sexual chemistry with emotional safety? And I want to say that again. Why do so many people confuse sexual chemistry with emotional safety? Because those two things could be very separate.
Yeah.
But also...
That's a great question. As you're talking about that, it's making me think of like social media and how things are portrayed versus how they're felt, right? It's a lot of times we look at how does this look instead of how does this feel for me? And I think that's maybe, I don't know if that answers your question or not, but being able to, I think that we're searching for it to look a certain way rather than checking in with ourselves and seeing, is this person emotionally hitting my needs just as much as maybe checking off some other boxes as well.
That stability, for sure. And how can couples talk about sex without turning it into a conflict or a shame? again, I keep going back to my past because of shame that was involved with any mention of that word.
Yes.
But I'm sure it's a tough subject for couples to talk about. So how do you work between conflict and shame?
Yeah, honestly, I have a similar background for you of growing up in Catholic faith. And so being not exposed to comprehensive sex education. And so I think the biggest in my office is being able to educate the couple on the comprehensive sex education part of it, the anatomy part of it, normalizing these things. And honestly, I find that the more that I am just talking about it matter of fact, it makes them feel more comfortable. But I also recommend things like podcasts. Like there is a Sex with Emily podcast. Is a great resource for couples to listen and being able to hear somebody else talk about these topics and then being able to reflect on these topics together. Another little tip is to have these conversations in the car so that y'all are in the same place, but you're not necessarily facing each other and having eye contact. So it makes it easier for people to have these types of conversations with each other.
I like that. In the car. Okay. And also with children.
Yeah.
Like a parent, if it's excruciatingly painful for them to discuss sex in the car, you're not facing each other. I can look out the window and pretend this isn't happening, but you're still listening and the conversation is still taking place. So
yep. Still they are listening, I promise.
And is low desire really the problem, or it is a symptom of something else? Or how do we know?
Such a great question. I feel like we focus so much on desire. So much on desire. And honestly, I would say that it is... I think that if we shift our focus from desire and focus, like you said, on something else of what would need to take place in order for our sex life to blossom. You know, maybe it's having those real conversations of, well, we need to have a date night again. We need to find childcare. We need to get out of the house and go to a hotel or something, making practical tips and things for couples to kind of prioritize their connection together. It gets pushed on the back burner a lot of times, and we'll get to it later. And I think that it's important for people to realize that that is an important part of their relationship.
Yeah, we all need to be reminded of that. How does control or lack thereof control show up in the bedroom without people realizing it?
Ooh, control.
And control can mean a lot of different things, but...
When I think about that, I think about the people that tell me that they can't get out of their head in the bedroom. Like they're trying to control the circumstances and everything, and so it's hard for them to be present in their body. So I don't know if that answers your question or if that touches on it, but being able to first of all, recognize that I am trying to control certain situations instead of being present in what's going on.
And relaxed.
And then getting curious about what's happening that's making me feel like I need to control the situation instead of just relaxing, because there might be a very valid reason why you've put that protection in place. And so you're able to talk about that and find a way to be able to be comfortable for both of you.
Yeah, and just let it happen naturally.
Yeah. Or schedule it. I know that's a controversial thing, but sometimes it doesn't happen naturally. And
well, that was one of my questions. I've heard that before. I've heard people say, yes, we are having a date night, and after dinner on Friday, that is our date night. We used to date when we were younger. Do it just like that.
Yeah. And actually, I have another little tip for people that I've heard is to prioritize sex before the date. So many times we go out, we eat this big dinner, we're feeling all bloated and tired, and the last thing we want to do when we get home is to have sex with our partner. And so that's where we a lot of times kind of push it aside. And so if we have sex first and then we go out on the date, that allows it to be a part of that date night more consistently.
Right. Okay, that makes sense. And why is vulnerability often more erotic than confidence?
Ooh.
Because that word vulnerability really, when I was thinking of my questions for you, really stood out?
Yeah, I like that. I love that question. I think people can fake confidence, and I don't think people can fake vulnerability. And so I think
that's a great answer. Being
able to be vulnerable with someone is so intimate in itself.
Emotionally vulnerable. That's hard. That's hard to do, right?
Yeah.
It takes a lot of trust. And what's the difference between wanting someone and wanting to be wanted by someone?
Oh, wanting someone and wanting to be wanted by someone. What do you mean?
Kind of like that, not the control question, but we all want to be wanted, right? How does that work as far as like difficult relationships or relationships that aren't necessarily healthy, and people constant, oh, I want that person to want me.
Okay. I would say look into attachment styles whenever
What does
I
that
think
mean?
about that. So attachment styles are what comes up from our caregivers, how we were brought up. And so if our caregivers met our needs consistently as we were growing up, we develop a secure attachment style, versus if our caregivers were not able to meet our needs consistently, whether for whatever reason, we develop an insecure attachment style, which might be anxiously attached or avoidantly attached. And so these might be some of the people that whenever a conflict comes up, I need to get this answered really quickly. This has to happen. I can't rest until something happens. Or the people that I'm just leaving and we're not having this conversation at all. And so
totally different.
I would say to work with a therapist on your attachment styles and being able to understand how that impacts your life so that you can figure out how that's showing up in your relationship.
What does healthy intimacy really look like over time? Not just in the beginning when it's fun and you're going on dates and you have all that fun stuff going on. And then as time moves on, how does that change?
That is a great question. I think first and foremost, recognizing that that's a thing. So many people get nervous whenever that spontaneity and that excitement phase kind of fizzles. But I think constant communication and constantly prioritizing each other's needs and checking in, right? Whether that be, I love the little card games that people do together, and they're able to kind of, whether it be 5 years into their relationship or 40 years into their relationship, being able to ask each other these questions back and forth and play together so that they can understand each other for the long haul. And I think being able to constantly learn about each other is how you grow together, how you love one another, getting to know how the other person needs to be loved. What are their love languages?
Yes.
And are you showing up for them in the way that they need? Are they showing up for you in the way that you need? And being open to talk about that. I think a lot of times we kind of push that down of, oh, well, I'm not really getting my needs met, but maybe it's okay. I won't say anything, but that might build. And so being able to openly communicate about these things and knowing that there's nothing wrong with us for having issues. We're human, we're living our life,
right?
And we're growing together. So there's going to be some hiccups along the way. Let's learn how to do these. And so I think that learning how to do that is communicating and learning how to resolve conflicts before they grow and grow and grow into something that you're resenting the other person.
Communicate.
Communication is lubrication.
Oh my gosh. Do you have a t-shirt? If you don't, I'm getting you one that says
is from Sex with Emily. I did not make that.
Okay. We can't take credit, but anyway.
Yeah. It's a beautiful, beautiful saying. Yes.
Oh, that's funny. Well, I like it. And what myths about sex and aging would you like to debunk?
That there's no age that you stop having sex. That you get to decide what you want your sex life to look like, and it can evolve with you throughout the age. And actually, I'm hearing more people in their 50s and 60s say that their sex life is getting better because they're having these types of conversations, and they're actually able to know themselves more now in this season of life. So they're able to communicate that with a partner, and they're able to grow from that and try new things. And
that shame and embarrassment goes out the door.
Right.
So some of that communication is easier, I'm sure, for some people. But And how do past experiences, on a more somber note, even trauma, how does that show up in a person's intimate life?
Absolutely, it shows up. How it shows up, it kind of varies. Everybody experiences trauma differently. And so for some people, they might have had a sexually traumatic experience, and they kind of they push back from sex and they avoid those types of things. Sometimes that makes people want to do it more. And so it everybody kind of responds differently to trauma. I think it's the same in sex as trauma is outside of sex, is getting curious about where did this trauma come from and learning how to feel safe in your body again after this traumatic experience, and being with a partner that is willing to understand that and to figure out what you need to be able to feel comfortable and to get to that place.
Yeah, and be patient.
Yes.
What's one uncomfortable truth about sex that could actually set people free, that they're listening today? Something that's uncomfortable, and you can tell us all, don't be uncomfortable. This is everyone, or...
People need to use more lube. Like,
Okay.
I don't know why people are scared.
Do you hear
feeling
this
like,
a lot in your practice?
I not that I'm hearing that people are using it. I'm hearing that they're not, and
Right.
so we feel like, oh, maybe I'm too dry down there. Maybe something's going on, and this could be eliminated by us adding something to the equation. I think that
Simple solution.
so much pressure that we put on ourselves. And so I want to tell people to add lube, add toys, add things to this equation that makes it more fun for you. There's nothing wrong with you for needing to add things. I like to say, if you add seasoning to your food, but you still eat it, it doesn't mean that the food was gross. You just are putting it to your taste buds. Same thing with sex toys and lubrication.
Okay, we just got a good reel right there. That's hilarious. Okay, what's my next question? Okay, I really wanted to know what your answer was to this one. What is the one thing that you wish people were taught about sex earlier in life? I know every parent, education, everyone has a different opinion on this. But what is your opinion as a sex positive therapist? When should we start teaching about sex?
I love that. I think that consent starts from very, very, very early age. And I think that it can be practiced in non-sexual ways that people don't even realize. I think about that with like animals, for example. If you have a small child and you have, let's say, a cat, and they're approaching the cat and the cat kind of pulls back, being able to teach the kid, oh, it looks like they're not wanting to be touched right now. Let's give them some space.
Okay.
And being able to model those things at a young age. And then as they get to an appropriate age where they're able to talk about more sex things, being able to use actual sex anatomy terms, being able to talk about these things in a question answer tone, and being able, I think more so for parents and people talking to kids about sex, being mindful about their opinions about sex and what they're putting on the conversation. And so a lot of times having to, I'm feeling really uncomfortable right now because of how sex was in my upbringing. Let me take some deep breaths real quick and get curious about what my child is actually asking me right now, so that I can answer their question and not put all of my fear around sex or my shame around sex on this question.
Yeah, sure. That's a great answer. And how does healing look like when it comes to a sexual or relational wound? We talked about trauma a little bit earlier. How does healing look like?
Accepting that you might have some hiccups along the way, and that is normal.
That's life, right?
That you, I think healing is getting curious about what's going on without judging. Instead of trying to run away from, I might have a problem, getting curious about, it seems like something's going on. What's happening? Can I get some support with this? instead of judging ourselves for maybe not being at the place that we thought we would be. Or I think so many couples think that every other couple is having all of this sex. And so being able to just know that that's not true. We're all kind of in the same boat. We all need to figure out what works best for us and not compare ourselves to other people.
Yes, in a non-judgmental way.
Mm-hmm.
And what role does self-trust and self-awareness play in intimacy?
Ooh, a huge role. Self-trust and self-awareness. I would say that you need to be self-aware to be able to have these types of conversations. It's going to be hard to get to a place of communicating about your intimacy if you're struggling to be aware about how you show up in these intimacy struggles.
Makes sense, yeah.
And so, I think that's maybe step number one is, can you get aware of your own self? And then let's get curious about the other layers.
Yeah. Look in the mirror first, right?
Mm-hmm.
And what is one word that you wish people would stop associating with sex? Like dirty.
That would probably be,
I'm throwing one out there that I've heard through the,
No, I would say that that's a really good one. I like that one because I think that people using that term dirty, it gets like, it makes it more like, oh, we can't talk about this,
Right.
And so being able
children and adults.
Right,
If children hear that word, then they think, oh, that's something to be ashamed of.
Right.
Or we don't talk about that, or
yeah,
whatever the case. So I don't want to put words in your
No,
mouth. But
that was an excellent word because I couldn't think of one myself, but that's a beautiful word that I wish people would like, no, it's just sex, people.
Yeah, exactly.
Yeah.
And what is one word you wish people would start associating with sex?
I wish more people would associate the word vulva with sex instead of
What?
vagina.
Okay. Why?
Because so many people just say penis, vagina, and that is just talking about reproductiveness whenever we talk about sex. And so being able to teach women, especially vulva owners especially, that it's called a vulva and that there's a part in there that is your vagina, but the whole makeup of it is the vulva. And so being able to get curious about it, because a lot of female nerve endings and pleasure comes from the other areas of the vulva besides the vagina. And so I think that when we just associate the vagina instead of vulva, we're missing out all of these
There's many more
awesome
parts
nerve
that
parts.
make this work. Yeah.
Yeah.
And I love science as a whole, so especially anatomy. So
Yes.
I can appreciate that answer for sure. And what would you say is the most underrated part of intimacy?
I think play. Play is a big way for us to connect and feel intimate with people. I think that sex is adult play, and I think we forget to have fun and play with each other. A lot of times we're so focused on it needs to look a certain way and we need to perform a certain way instead of we're just having fun together
And
we're enjoying this, and we're seeing what feels good and what smells good and what tastes good and all the things, instead of, oh, does this look right? Am I doing this right?
Yeah, so many pressures. Just let that go.
Yeah.
And what's one small step that our listeners can take with them this week
Okay.
to work towards a deeper connection with their partner?
I think asking themselves the question, am I enjoying the sex that I'm having right now? And if the answer is yes, what are you enjoying about the sex that you're having? And if the answer is no, getting curious about what would you enjoy about sex? What do you need to add to make it more enjoyable for you? What do you need to take away that's not enjoyable for you? And so,
Yeah, that leads to a deeper connection for sure. And what question do you wish more people had the courage to ask themselves?
Probably that same question. Am I enjoying the sex that I'm having? Instead of getting curious about, is this normal? Are we doing it enough times? All the things, being
Right.
able to just hold on. Am I enjoying this?
Right.
Do I want to be here?
All these different pressures.
Yeah.
Let it go, just like before. And if people wanted to learn more about you or to follow you or see you at your practice, how could they do so?
So they can follow me at, Growth with Gabby on Instagram, or I am at Headspace Counseling and Recovery off of kind of behind Women's and Children's and by STM in that area over there at a private practice. And so they can call the office and set up an appointment with me or consultation. I'd be happy to get them started.
Okay, and you mentioned a little bit about your background, that you were raised here in Louisiana and you were Catholic. What are your thoughts or what are your views on that as far as either sex education or viewing it as something shameful?
I wish that we would allow comprehensive sex education in our classrooms so that people can make an informed decision with their values on what they want to do with sex. And so growing up in a Catholic environment, you're absolutely allowed to have those values and to feel that maybe you're wanting to wait until marriage. And I think that doesn't prevent you from learning the information about sex and having accurate, comprehensive anatomy information to go off of whenever you are ready to engage in a sexual relationship.
And do you, with sex positive therapy, do you see a lot of patients that are gay, lesbian, bisexual? Do you have all clients across the board?
All across the board.
Okay.
I see all the people.
And have you seen in your practice through those patients trauma or healing? Again, being from this area, I know it's everywhere, but
oh, absolutely. I
South.
would say being in this area, especially the people that are directly from this area, there's a lot of these same types of conversations of there was shame involved with it. We're not supposed to talk about these things.
Right.
And so being able to learn how to kind of remove that shame layer of things and then being able to get them comfortable with actually communicating about sex so that we can talk about what they need to talk about. So I say that I do see it show up a lot in my clients of people that have felt repressed in what they know about sex, and maybe that shows up in them feeling insecure or whatnot. And so being able to educate them on the things that they weren't educated on so that they can now make an informed decision.
Right. And it's not dirty.
Yeah.
Or always, sinful or whatnot. It's personal and private and intimate, and it's individually, it's individually made for everyone. So
yeah.
And one final message.
Okay.
I know we've covered a lot of ground today, but if you had one final message to leave us with, what would it be?
Don't be afraid to explore your sex life. It is a very important part of yourself, and you deserve to learn about yourself and what you enjoy and what you find pleasurable. And so, I hope that it gives people the courage to just get curious about themselves, even if it's women looking at themselves in the mirror tonight, just one little thing of, oh, this is okay, this is normal, and I'm allowed to do this.
Yes, and sex is to be enjoyed.
Yeah.
It's to be enjoyed.
It's pleasurable.
It's a part of life.
Yeah.
So, well, thank you. Thank you so much for being here.
Thank you for having me.
But my last question of the day is always,
okay.
How do you maintain your posture while pursuing your purpose in life?
Good question. I would say being able to remind myself of maybe individuals that didn't have this type of model, this type of resource, and being able to remind myself that I can be that for somebody else in the future, of normalizing sexuality and making people feel comfortable with being a human that enjoys sex.
Yes, and that it's safe and that it's to be enjoyed.
Yeah.
So good. Thank you so much for being
thank
here today.
you.
I've learned so much. I hope our listeners have learned a lot as well. And until next time, sit up straight, stay happy, stay healthy, and stay adjusted.
Thanks for listening to the Posture and Purpose podcast with Dr. Michelle Carr-Frank. Make sure to subscribe on YouTube, Spotify, and Apple Podcasts. Until next time.